This video again I am discussing a recall that is come on Jeddah 2023 May. The task was that mother has 4 kids and this is the smaller one. He has CP with recurrent cough and chest infection and disturbed sleep with pulling of the NG tube and losing weight. The consultant decided to do the gastrostomy. Role player asked about the pain, bleeding and sleeping medicine. Why you want to remove this NG tube? So for gastrostomy consent, gastrostomy tube consent. As usual, we are starting as a IRCAP, introducing myself, making the report, taking the consent, telling the agenda and the attendance and prior knowledge. Do not forget to stoma nurse. Okay, the nurse will explain that after the end of the meeting, everything details. So I'll start like, I know you are such a keen ma'am. I know you are doing such a great effort taking care of your child. I know it is not easy to take care of a CP child, but you are doing your best, and I'm really admire you for your effort. Okay. So any chronic condition you tell that is really an honor to sit with a ma'am like you. You are taking the best of your effort. You are giving praise the mother. Okay, thank you, doctor. I am here to take a consent from you to do a gastrostomy tube for Ali, and hoping at the end of the meeting I can take that consent. What is it? So we'll draw a picture that is gastrostomy tube. How draw a stomach, then the tube we will attach. So it is a tube from the skin outside to inside the stomach through which we can feed him and give him medication. So it is a tube from outside to inside to the stomach, but which by this tube we can give him feed and medications from outside to inside. Is it a surgery? Yes, it can be done either by open surgery or a keyhole surgery. What is keyhole surgery? It is an endoscopic surgery. So why he need this tube? Because to be able to feed him and give him his medications. So gastrostomy tube we are giving because we are able to feed him and give him medications. Any alternative? Yes, NG tube is alternative, but you said that he pulling out, repeatedly pulling out in our task. That's why we are giving gastrostomy tube. And also, CP patient has swallowing problem. He's not gaining weight. That's why. Are you with me? Oh, doctor, what is the drawbacks? Drawbacks of the sleeping medicine, pain, bleeding, and infections. Say the problem and the solutions. So first, also there are temporary drawbacks. There is a risk of obstruction. But if this happen, first of all, you will do massage of the tube between your fingers. If it did not work, you can get a 50 ml syringe and fill it with warm water and try to push and pull technique. If it did not work, you can use a carbonated water preparations. After that, if still not work, you should seek medical advice immediately. Are you with me? So there are some drawbacks like pain, sleeping medicine we'll give, or painkiller we are giving, and we are doing it very much hygienic procedure, so catching bug with less risk. But there is a chance of obstruction. We need to tell that what she do. She will be messaged by 2 fingers, and also she give 50 ml warm saline or water to push and pull technique to clear this. If it's not work, then use the carbonated water preparation. After that is still not work, you seek the medical advice immediately. Okay, doctor. Also, there is a risk of dislodgement, and if this happen, you will put NG tube in the opedic and then go to the emergency room immediately. If it is dislodgement occur, then she will put a NG tube in the opening and then go to the emergency room. Yes, doctor. It may be there is a risk of leaking, but we will use skin protection cream, and if still leaking, you should seek medical advice. So skin protection cream also we advise. Are you with me? Yes, doctor, but I do not know anything about how to take care of the gastrostomy tube. You will not leave this hospital till we have a meeting with a specialized nurse who teach you everything you should know about care of the gastrostomy tube. So after the meeting, a specialized nurse will teach everything very easily. Here I am, the consent taking. So how to feed him through this tube? We have two types of feeding, continuous feeding and the bolus feeding. Continuous feeding is by using an electrical pump, allowing certain types of food to go into the stomach over a period of time. And bolus feeding by special syringe, you will put a small semi-solid fluid and you will push it through the tube and then to the stomach. Okay. What about hydrotherapy? So once the stomach is healed, he can do the hydrotherapy, take shower and swimming. So mother if asking that how about the feeding I am giving? Two type, continuous and bolus. Continuous by electrical pump, it will go certain amount, one by one certain amount of food. And bolus is like the syringe you are giving the feed. Hydrotherapy when the once the healed the area, the stomach healed, then we can he can take the hydrotherapy, take the shower and swimming. How can I give him tablet through this tube? Tablets should be crushed and dissolved in water, and after that can be given to him. Then Summary, website, leaflets, trusted group, support group. We'll ask, do you have any other concern? And so, ma'am, are you agree with our plan about the gastrostomy tube? So, if every consent at the end, we'll tell that. So, are you agree with our plan or management? So, this is all about gastrostomy consent communications. Thank you.